Welcome again to Decoding Healthcare Research. I'm your host, Efrain Riveros, Dr. E.F. Rain. Today, we are going to be talking about metabolism, sleep, the different interactions between sleep, insulin sensitivity, and glycosylated hemoglobin. And we have the privilege of having with us Dr. Thiru Kanagasabai. She finished her PhD at York University in Toronto, and right now she's conducting her postdoctoral fellowship in St. Lawrence University in the United States. So welcome, Dr. Thiru.
Welcome. Thank you for having me, and thank you for the invitation to do this podcast. I'm really passionate about doing sleep research, and this is a great opportunity because sleep has a huge amount of effect on many things in our health and well-being.
Absolutely, and it's not a secret that that health is derived by the interaction of different aspects, including nutrition, physical activity, emotional stability, and sleep. So sleep is at the center of it all. And in the past, sleep was thought of as something that you need to restore your organism, but it wasn't really conceived as an integral part of the health, physiology. And in that regard, I want to ask you first, what was your motivation to start connecting the dots between sleep and metabolism?
Well, I think it really began as a child. I was one of those children who likes to get adequate amount of sleep, and I became interested in it. And my my PhD supervisor was also interested in it. And we just started to talk about different projects. Because a PhD is a long program, we started to talk about different types of research that we could do. And it ended up being that we found we have a mutual interest in sleep. So I just started to dig a little bit deeper, and you learned a lot about sleep, history of it, and learned a lot about the interesting research that's been going on. But our interest was mainly from an epidemiological perspective. So we were able to use data that was already collected, and we know that sleep is beneficial for cardiovascular health, metabolic health. So as a starting point, I was really doing research on the metabolic syndrome, but it slowly progressed to more in-depth research. And we ended up looking at insulin levels and glycosylated hemoglobin in this paper.
Yeah, and we actually are alluding to a paper that was published in Frontiers in Public Health in 2022. The title of the paper is Inflammation, Oxidative Stress, and Antioxidant Micronutrients as Mediators of the Relationship Between Sleep, Insulin Sensitivity, and Glycosylated Hemoglobin. And I find a lot of value in your paper because it's clear that you are trying to find the link between those two processes, the quality and duration of sleep and metabolic markers. And it's not a secret that connection has been difficult to make. And you explore mediators between those two aspects of human health, sleep and the metabolism of sugar. So you conducted a study, as you mentioned, that uses data that was already collected, a very robust survey, actually, that you are going to talk about. But first, I want to discuss a little bit about the background of the study. So you try to establish a connection between different inflammatory elements and sleep, and also insulin sensitivity. How does all this come together?
Very good question. And to go over that, I must really thank my research endeavors in my master's program, where I looked at oxidative stress. So when I transitioned in my PhD, I used to do research in animals up until my master's. And then when I transitioned into my PhD, I brought in all of that knowledge. So I really wanted to look at oxidative stress markers and inflammatory markers. And we already know that diet is beneficial, a healthy diet is beneficial, and we already have knowledge that certain vitamins and minerals are important for health. So that was a natural progression, and we just brought that information into my PhD work. And we really wanted to link, when we identified that we wanted to look at sleep and metabolic health, we wanted to find a way to link all of those three factors. And doing a mediation analysis, although this paper is a little bit stats heavy, it made sense, and there was a current knowledge gap in that area. So we were able to put together that project pretty quickly and in a very in-depth way. This project actually resulted in 4 papers. We began publishing the initial papers in 2014 in the journal Sleep, and this is the 4th paper that you picked up. So it's a package of papers that provide similar findings, looking at sleep duration and sleep quality and cardiometabolic markers. In this particular paper, we focused on diabetes markers such as insulin and glycosylated hemoglobin.
Excellent. And it's actually very nicely put. And we are going to talk about those statistical methods a little bit more in detail for lay people like myself that are not experts in this type of design, but it's really intriguing and exciting what comes ahead. So the first thing is, let's talk about the source of that information. So where did you get your information from?
So for this particular study, we used the data set NHANES. It's the National Health and Nutrition Examination Survey. The CDC basically collects data from about 10,000 participants every couple of years in the US. They go through this fabulous multi-stage sampling method, which makes the data really nationally representative of the US population. So those 10,000 participants' data can be used to represent about 340 million people in the US. So they used the sampling method to collect data that can be used to make informed decisions about the population. And they make this data available freely to researchers and even to citizen scientists if they want to use it. Some of the data is restricted, but the data that we used is publicly available. And we used data from the 2005-2006 cycle. So it was just one of the cycle that we used. And from that 10,000 participants, we dwindled down our sample size because we needed to have data that had all the sleep variables, all the mediator variables, and all the outcome variables that we were looking at. So we ended up getting about 2,000 participants that we were able to analyze our models with.
Yeah, you mentioned that there are 3 types of variables that were important for you to actually put together the study. You talk about exposure, outcome, and mediators. So what is the right way to put them together?
That's a good question. And statistically speaking, you have your exposure and then you have your outcome. And most studies look at the exposure outcome relationship only. So in our study, we wanted to look at the exposure and outcome, and we wanted to see a middle variable. We wanted to know what that mediator is and how much of that mediator is having an effect on that outcome. So it is still, broadly speaking, it is still a very tiny, it provides very tiny information about the whole concept of sleep and metabolic health. But in this particular study, we looked at something that that is rarely done in research because, as I said, most studies look at their exposure and outcome, and it's statistically, it's really intense to look at anything else. But nowadays, we do have better methods developing. So as a result, I was lucky enough to find the mediation method, and I was able to look at the exposure and outcome and assess these mediators. And we assessed 9 different mediators in this project.
Yeah, and that model is very interesting, and is not something that you find like frequently in papers. Can you tell us a little bit in a nutshell, what is a mediation model?
Absolutely. So essentially, in statistics, we do regression models to look at the exposure-outcome relationship. And a mediation is just a bunch of regressions put together. So we independently, you can conduct regression looking at the exposure and the mediator, exposure and the multiple ways. You can look at the 2 different variables and the 3 different variables in the same model, and which is what we did. But in my initial papers, I actually did the independent path analyses, which is probably a little stats heavy. In this particular paper, I was actually able to use somebody else's SAS, some basically statistical analytical code that they had already developed. His name is Andrew Hayes. He's I believe he's a psychologist. He must be at, he's in Canada right now, but he used to be in the States. So I was able to use his code for that. He had better codes now because this analysis was done 5-6 years ago. So he has better codes now. So if you're a little bit if you're able to understand statistical models, you can use his code. You can just put in those variables. You can put in your exposure variables. You can put in your outcome variables. You can put in your mediation variables, and it will tell you how much of the exposure outcome relationship is mediated by this other variable that you're really interested in studying. And in that case, it just ended up being oxidative stress and inflammation and all of these antioxidants that we looked at for this particular study. That's what we focused on. In another study, in another study, we focused on physical activity. It's a similar approach, but we focused on physical activity.
Yeah, and it's a nice way to put it together, because especially when the connections are not that clear, this type of modeling that you used starts shedding some light into those relationships, and that's something that is actually a great contribution of your paper to the understanding of the intricacies of the relationships between sleep and in this case metabolic variables. So let's talk about the exposures. What were the exposures that you evaluated?
So we evaluated sleep duration, which was basically from one single questionnaire from the sleep disorder question that the NHANES used. And sleep quality was assessed a little bit more complexly. Sleep quality was assessed through 6 different questionnaires from the NHANES, and we took those responses and we were able to sum those responses up and then recategorize them when we considered sleep quality. Sleep duration it's much easier to measure. Sleep quality, we don't really know what it is. Even in the sleep medicine literature, different people have different definition for sleep quality. So we were trying to we based our definition of sleep quality based on a previous paper, but still in sleep medicine, we don't really know what sleep quality is. So it was difficult, and it was much more complicated. Even when you're interpreting the results, it's much more complicated. But sleep duration is much more easier to define. And NHANES basically asked people, how much are you sleeping per day during the weekdays? And they collected the responses as whole numbers. They collected responses as 1 to 11 hours per day during the nighttime, obviously. And if they said more than 12 hours, they truncated those responses. And essentially, they provided that information to participants. They provided participants information on that. And we took that information. The only thing is, NHANES doesn't collect data on children when it comes to sleep. So that's a limitation. And that's why we stayed away from doing studies on children. But they do have adult information, and we collected that information. Sleep duration was much more easier to get information about. Sleep quality is really still very difficult to get information on.
Yeah, there is a lot of subjectivity there. So we have the exposure, then is sleep quality and duration. Let's talk about the outcomes. What were the outcomes variables?
In this particular study, we looked at fasting insulin concentration, and we also looked at glycosylated hemoglobin. So that's your HbA1c. It's commonly used to assess people's glycemic glucose control over a 2 to 3 month period. And fasting insulin is not something that clinicians typically use to assess glycemic control, but it could be a good indicator for insulin resistance. So if they have really high fasting glucose, it might be an indication that the patient has insulin resistance. But glycosylated hemoglobin, which is the A1C, it's a really common marker for glucose control.
Yeah, excellent. So we are connecting then sleep with the blood sugar metabolism. Now, what are the mediators that you are trying to evaluate?
So we did evaluate 9 different mediators. It is a bit, this was a big study because we had multiple exposures, multiple outcome, and 9 different mediators. We looked at, because NHANES had these data available, and because my background is toxicology and I was able to learn a lot from my master's work, I wanted to study inflammation and oxidative stress. So I looked at C-reactive protein. It's a protein that's indicative of inflammation in the body. And I looked at gamma glutamyl transferase, which is really a liver enzyme, and it's commonly used to identify alcohol-related liver disease in clinical settings. But there's indication that that enzyme actually is involved in reactive oxygen species generation. So we wanted to study that as a marker of oxidative stress. And then the rest of the and mediators that we looked at, including uric acid and bilirubin and vitamin A, C, D, and E. And then we also looked at carotenoids. Some of them are endogenous antioxidants, and some of them are antioxidants that we eat in order to have it in our system, such as vitamin C. But some bilirubin and uric acid can be considered as something that they're considered as endogenous antioxidants.
Yeah, that's awesome. So we have a marker of inflammation, another one of oxidation, and a bunch of them to evaluate antioxidant capacity. And you put them all together with this mediation method. So let's move on to the results. What did you find?
We found that sleep and fasting insulin levels are mediated through several of these antioxidants. In fact, they were mediated through 7 of the 9 antioxidant and the inflammatory and oxidative stress markers that we looked at. So in our study, we found that sleep and fasting insulin level is mediated through inflammation, which we know intuitively that inflammation plays a role. It was mediated through gamma glutamyl transferase, which is our oxidative stress marker. And it makes sense because inflammation and antioxidants are really 2 sides of the same coin. They're interconnected. We also found that bilirubin and uric acid have effect on our the relationship between sleep and fasting insulin level. We additionally learned that vitamin C and vitamin D and carotenoids are also important for this relationship. They're good mediators of this relationship that we looked at. So 7 of the 9 markers that we looked at, they're pretty important for this relationship between sleep and fasting insulin level. And some of these are also important for our glycosylated hemoglobin, the HbA1c. So that was also an interesting finding, because we know that glycosylated hemoglobin has such a narrow homeostatic range. So it was interesting that we actually found something. Although it was a modest finding, we found something for that.
Mm-hmm. Mm-hmm. Yeah, and it clearly establishes a connection, right? That is that is critical in this aspect. So my question actually, and I think my audience is asking the same type of question, is what would be the implication of your findings? What is because I know it's probably too early to talk about clinical application, but what do you think these findings are pointing to?
So I don't, in my personal opinion, we know a lot about sleep. We know that it has an effect on insulin sensitivity. We know that it has an effect on glucose metabolism. In fact, when you sleep adequately, your brain utilizes glucose at a greater capacity than if you don't sleep. Sleep also has an effect on your physical activity level. Sleep also has an effect on your dietary habit. So sleep is an important exposure. So generally speaking, improving sleep behaviors could be one of the things that we can promote at the population level. In terms of directly affecting diabetes risk, especially for patients who are prone to diabetes. In Canada, about 1 in 10 adults have diabetes in Canada. It's much higher in some countries like India and Sri Lanka, where I was born. And even in some Asian countries, diabetes is becoming a bigger problem. But sleep is not prioritized, as you mentioned earlier. So this is something that we should focus on. That is to promote healthy sleep among all age groups, to reduce health risk, whatever the health risk is. It doesn't have to be diabetes. It could be mental health risk. It could be other types of health risk. But directly relating to diabetes, however, we know that when it comes to the mediators alone, we can talk more about improving dietary habits so that people have the capacity to consume adequate nutrition, including those antioxidants that we talked about, especially the vitamin C and the vitamin D, so that they have adequate protection.
Yeah, and that is something that can entail, significant applications in the future. And I like something that you mentioned in your paper, that poor sleep can lead to inflammation, and that inflammation is going to affect multiple cardiometabolic outcomes. And that inflammation is also, as we know, associated with insulin resistance. It's like poor sleep is contributing somehow to metabolic syndrome. Obviously, this is a cross-sectional study, and you cannot make inferences about the causality. Probably there are also consequences of poor metabolic health that are affecting sleep. It can go in both directions, right?
Exactly. And you're right. This is a cross-sectional study. If you look at the space between my hand as time, we really took data from one tiny cross-section and we just took a little peek at it. the problem itself is much more bigger than that. And it is frowned upon in the epidemiological field to use cross-sectional data to make causal reference. But in the mediation model is a causal model. So even at the lower end of the study design, we were able to provide this evidence. So it is a positive thing for policymakers and even governments to use that information, and especially come up with ways to promote sleep, but also dietary behaviors, because that will only have a positive outcome on people's diabetes risk.
Yeah, that's true. And something that you say that I want to highlight is exactly that the cross-sectional studies will always have the limitation of finding causation relationships, but the mediation model is kind of a workaround that allows you to, at least with more certainty, say that there may be a causal relationship, and that's something that we need to underscore here. So knowing that you found this, what do you think should be the next steps in research to try to fine-tune actually these findings?
So as a researcher, we like to do more research. I would love to do research with longitudinal data, because that just provides more stronger evidence compared to a cross-sectional data. And so far, I haven't been able to find data of high quality where I can do a similar study. I even looked at the American Heart Health study data, the sleep heart health study data, to do some sort of a study really using the mediation analysis. And because when you're dealing with secondary data, you have your limitations. So, and their study was designed to collect data that had a different purpose. So I wasn't able to do a study with that type of a data. But in the future, we should collect data that has more longitudinal information, and we would be able to provide stronger evidence using that type of a data.
Absolutely. So I want to close our conversation by telling our audience about the robustness of the study and the conclusion, and probably one application that can actually be drawn out of the study and actually be used immediately is to pay more attention to sleep, right? So pay attention to the duration of sleep. Part of the duration of sleep is voluntary. So the time probably you go to bed is going to affect this. Something to start paying attention. And you mentioned the use of antioxidants that are of easy access and low risk, like the use of vitamin supplements, specifically vitamins D, E, and A. Those are things that are applicable like right now, while we wait for further results. And I am going to be on the lookout for your research, and I hope that we can meet in the future and discuss what's new about this exciting topic. I want to thank you, Dr. Thiru, for being here with us and share this experience. And I am sure that our audience are going to enjoy this immensely. Thank you so much.
Thank you so much for the invitation. And as you said, there's so much possibility, and I really do think that people can benefit from it. And an easy way to do that is to pay attention to the sleep habits and try to improve that.
Yeah, sleep hygiene is central to health, and this paper reinforces that idea. I appreciate it. Thank you so much. And for our audience, the link to the paper can be found in the description of the video. Don't forget to leave us your feedback, and see you in the next episode of Decoding Healthcare Research. Thank you so much.